Good morning, everybody. I'm Sarah Lentini, President and CEO of the Greece Regional Chamber of Commerce, and it's my great pleasure to welcome you here this morning. We're very delighted that Dr. Nancy Bennett, who is the lead of the Finger Lakes COVID-19 Vaccine Hub, is joining us here today to tell us a little bit about the plan for rolling out the COVID-19 vaccine, specifically in our region, the Finger Lakes region, and also to have a little bit of dialogue with us because you may have questions. We are so happy to be able to learn about this very important topic. And I'm also particularly delighted to have you here, Dr. Bennett. You have a long and illustrious history in public health in this community and beyond. And we're very glad that you were tapped to lead the vaccine hub. And also, again, thank you so much for graciously coming to talk with us. Welcome.
Well, thank you so much. And it's really a pleasure to be with all of you this morning. I am going to share my screen because I have slides. You know, doctors can't talk without slides. So, and I'm no exception. So give me 1 minute just to find them. Okay. So can you see my slides?
Yes.
Good. There. Why is it not behaving? Oh, there we go. Okay, good. Let me just 1 moment. Okay, we're good, I think. Are you seeing just one slide or are you seeing two?
Well, one slide with the next slide showing ever so slightly on the right.
I don't want it to do that. Let me do this again. It's because I had it plugged into my large computer. So let me just do it once more.
Absolutely.
Sorry about that. There, is that better?
That is perfect.
Good, okay. So I wanted to tell you today a little bit about the infrastructure behind how we're approaching vaccination in our community. And I know that there's been a huge amount of frustration. There's also been some confusion. There's been a lot of just, difficulty accessing vaccine. And I wanted to sort of give you the framework for how this is happening. And so I'll start with a little bit of our infrastructure. Oh, great. So now I'm not advancing for some reason. This is just one of those days, right? I don't know why. Let me try that. Nope, it won't advance. Okay. Nope. I apologize. Usually I've got this down pat, but it's not working today. I'm going to try once more.
No problem. We've all been there. I was muted. Yeah. You didn't hear me, but I was there yesterday. So
I don't know why it's doing this, but let me go back to the beginning. See if this works. Okay, once more.
That's great.
There. Yes. Yes.
Perfect.
I apologize. The wonders of modern technology.
Yeah.
So first of all, what I wanted to tell you is that, to do this effort to vaccinate 1.2 million people in the Finger Lakes region is really an effort that requires absolutely everyone's participation. So we think of this as a big, broad network that includes some of these organizations you can see on these boxes at the bottom. But the gist is that it really is going to take government, it's going to take community organizations, it's obviously taking the healthcare system to help, businesses. Almost everyone has some role to play in getting everyone in our community vaccinated. And the way this is structured is that we have something called the hub. And what happened was that at the level of New York State, they decided that they needed some different infrastructure for doing this whole project, that public health departments on their own needed more help. And also that we wanted to take more of a regional approach. And so the state divided New York up into regions and designated hubs at the center of each of those regions. And for our region, the medical center, the URMC Medical Center, Strong Memorial Hospital is the hub. And so as a result, we have put together a team, and we basically are responsible for coordination across the whole region and ensuring that everyone gets access to vaccine as rapidly as we can. We don't actually vaccinate anyone. We coordinate and make sure that things are going well. We meet every morning. I just came from our morning meeting with all the vaccinators in the region to try to figure out what problems people are having, to figure out how to address those problems. And I can tell you the problem this week, which is a new problem, is none of the vaccine has arrived. The weather disruptions across the country have created a nightmare. And so no one has gotten any vaccine this week so far. So every week it's something new. But the purpose of of having the hub infrastructure is to have some staffing that can help with this kind of coordination, training, operations, and so forth. So the structure we have is that we work with two liaisons from New York State, Vinny Esposito, who many of you may know, and Brian Gallagher, who's from the Department of Health. Vinny is more connected to the governor's office and Brian to the Department of Health. And then we have the hub on one side, which is centered in the medical center, but really its own separate thing. And then on the other side, the vaccine task force. And that's co-chaired with me by Wade Norwood, and is very focused on ensuring that we have equity in our approach to how we distribute vaccine throughout the region. And then, as I mentioned before, the network is the tons of different people who are involved in this effort. So our role is to really plan, facilitate, and execute the vaccine administration plan. And our three values that are really important to us are equity, transparency, and efficiency. Oh. And you can imagine that sometimes these come in conflict with one another, but we've really tried to make this sort of our hallmark. This is what we really care about. And our goal is to vaccinate at least 70% of the Finger Lakes population. It'd be great if we got to 80 or 90, but at least we're shooting to ensure that we have 70% of our population vaccinated. This is our scope, so you all are familiar with these counties. It's also the economic development region, corresponds to that, as do many of the hubs across the region. So here's the long, complicated story. So when the country was facing the idea of vaccinating the country as rapidly as possible, we knew there would be a scarcity of vaccine in the beginning. Everyone knew that. We knew that it wasn't like they were going to plunk 300 million doses on the US in one fell swoop. And so the National Academies of Medicine and also the Advisory Committee on Immunization Practices, which is a CDC-related committee, both took very seriously the need to prioritize populations. And they each came up with slightly different but pretty similar priorities. And the first priority was healthcare workers, because they are needed, obviously, to take care of the pandemic. But they've also been very hard hit by the pandemic. And then the second critical group was those who live in long-term care. In our community, as in many communities across the country, 50% of the deaths have been among people who are in long-term care. So clearly a population that needs to be protected. And actually, to protect those patients, the best way to protect them is to vaccinate the staff. Older people don't always develop as good an immune response to a vaccine. And so you want to ensure that you can kind of cocoon them by vaccinating the people who are around them. The second consideration was people who cannot work from home and who are required to go out and do things for us in our society. And so those were essential workers. And each group has a slightly different definition of essential workers. The national definition of essential workers was a little broader than New York State has adopted. But essentially, it's the people who keep our society going. And they're, obviously critical to how we live day to day. In addition, those over the age of 65 are at greater risk of having severe disease or dying. And so they were also included in this. That was a change from the original national recommendations. The original national recommendations had those over the age of 65 and those with chronic conditions in a third category. But in New York State, it was decided that these two groups would be added in. New York State also allowed for adding restaurant workers and taxi drivers, rideshare drivers, et cetera. In our region, we have not done that yet because we simply have so many people to vaccinate who are already eligible. And so we have not added in restaurant workers or rideshare. The other real complexity has been that the vaccine comes via New York State, and New York State decides who it goes to. So we have no say at a local level. The vaccine is allocated each week to particular places, and that's where it goes. The only say that we have locally is that we can sometimes reallocate or redistribute some vaccine if we think that there's a place that needs to get vaccine for a particular reason. And I'll show you in a few minutes how the vaccine's been allocated. Along with those allocations have been restrictions about who can vaccinate whom. And this is just an outline of that, but you can see why it's so complicated and so confusing to people. So if you are an essential worker, you need to go to a public health agency to get your vaccine. You're not going to get your vaccine from a pharmacy. Pharmacies are only allowed to vaccinate those who are over the age of 65. If you're a person who is between the ages of 16 and 64 with chronic conditions, you can go possibly to your federally qualified health center. You can possibly go to the county health department, but there's not a lot of availability, so it's very complicated. The large sites like the Dome Arena are run by the state. And at that site, all people who are eligible in 1A or 1B can go to be vaccinated. And then lastly, there was a federal pharmacy partnership that worked with the skilled nursing facilities and also the assisted living facilities to vaccinate their staff and their patients. And that is coming towards the end. But it's been very helpful for getting those populations vaccinated. So here's where all the complexity lies. I wanted to just give you a feel for where we are. So as I just told you, no vaccine has arrived this week yet. So we're not anywhere at the moment for this week. And this week is week 10. So you can see we got more vaccine this week into our region, 20,000 doses, much of which went to Monroe County because it is the most populous county. But the cumulative allocation since week 1 has been about 141,000 doses. So lots of vaccine, but when you think about the size of our population, not really. And that's what this slide depicts. And this is really just those who are eligible already. So all the eligible people I just mentioned, including those who were added this week, which is the age 16 to 64 with chronic conditions. So there's 671,000 people in our region, and we've gotten 140,000 doses. So that tells you the whole story. There you have it. We just don't have enough vaccine for the number of people who are eligible. We assume that a certain percentage of people will refuse. And so for the purposes of this exercise, we assumed that only 80% of people will accept vaccine. But that still leaves 537,000 people that need to be vaccinated right now that are currently eligible. And so that comes out to being about 26% of the eligible that are covered by our existing vaccine supplies. And that's including the 20,000 that hasn't arrived yet this week. So just to give you a feel for where the vaccine is going, it's been quite different over time. And one of the difficulties of the entire system has been not knowing until the week before, not even the week before. Basically, people find out on Saturday or Sunday whether they're going to get vaccine that week. And you can see it's changed dramatically. When we started out with healthcare workers, most of the vaccine went to the yellow, the hospitals. Then over time, there was a shift to more vaccine going to local health departments for essential workers. Then the large dome came on site, that's the purple. So we've seen this variability, and you can see that the hospitals now are getting very little vaccine. They're really, at this point, just vaccinating the remainder of the 1A healthcare worker population. They're also allowed, if they have extra, to use some for patients. We had thought a few weeks ago that the hospitals would vaccinate many of their patients, and they set up the systems to do so. It was really the plan. And then all of a sudden the state shifted and decided that they didn't want hospitals to vaccinate their patients, that they wanted a lot of this to occur in public health. So we're in a kind of quasi in-between period where the hospitals are not getting much vaccine. It may turn out that they'll get more vaccine going forward. We just don't know at this point. The state's strategy, I think, is largely to employ very large vaccination sites like the Dome Arena or like the Convention Center, which Monroe County has been using. But we're hoping that hospitals will be back in the game, because hospitals are able to reach out to their patients in a way that's very efficient and effective. And they all got used to doing large clinics because they were doing all of their workers. So we're hopeful they'll be back in the game at some point. And this is just where these various vaccine places are. And you can see, actually the slide's a little hard to see, but you can see that there are operational clinics really throughout the region. Those are the red dots. There are some that are planned. I think there are only a couple that aren't operational at this time. And then also on this map are the pharmacies, and there are pharmacies spread. But you can see that in some of the rural regions, there's really not a lot. There's very limited resources. And so the county health departments are setting up clinics in those regions, but we definitely have to up the game, and they just haven't gotten enough vaccine yet to do very much. So we have a model for thinking about how we're going to do this long term and for more and more people as more and more vaccine becomes available. And some of the parameters in the model are listed on this slide. I just thought you might be interested. So we talk about stations, and stations basically are a vaccinator, and a vaccinator can give about 10 shots an hour. As you can see in our region, we already have 194 stations. And that basically, many of the vaccination sites will have 10 stations, for example. But some of them are, just have one or two. So these are the assumptions that go into the model. And we know now by running this model that we have sufficient capacity to vaccinate people very quickly. The problem is we just don't have the doses that we need. And you can see from this chart that we really, if we wanted to finish the currently eligible people in 60 days, we'd need on the order of 40,000 doses a week, and we're just not getting that. We're halfway there, maybe we will get there. And then we could actually do the whole population in 150 days. But again, if we had closer to 60,000 doses a week. So we know we have the capacity, but what we don't have is the vaccine at this point. And this is just the difference in time that it will take to vaccinate the entire region and the currently eligible. So the brown line is currently eligible. The blue line is the entire population. And you can see that it's just a huge difference based on how much vaccine we receive. We could do it all pretty quickly if we got a lot of vaccine, but without that vaccine, it's going to take a really long time. So the takeaway message on with respect to this model is that we really have sufficient capacity. We just don't have sufficient vaccine. And if we continue at this current rate, it's going to take a very long time to vaccinate everyone. But I don't think we'll continue at this current rate. I think vaccine supplies will increase. We have another vaccine coming on the market, we hope. It will be presented to the FDA at the end of next week, and we hope that it'll be approved and that that vaccine will be available in March. And that will increase supplies significantly. One of the things we learned through our model also is the importance of sharing. So in the model, we made certain assumptions about the way that the region could share with one another. And it's clear that we need to do that, because if we try to do it county by county, it will actually take longer. It will be much less efficient. So it's really important that we share our resources across the region. We do have some information sources available to people in the community. 211 now can answer questions about vaccine and can direct people towards available resources. That doesn't mean you'll get an appointment, however. At our website, we also have similar information about who has vaccine, who's vaccinating, how do you access appointments, and so forth. And then the state website also has a great deal of information. But in order to get appointments for the state site, that is the Dome Arena, you can go to the state phone number or state website. And actually last weekend, they freed up a lot of appointments because they were expecting to receive much more vaccine this week. And they got booked up pretty quickly. However, if you return to the site, sometimes people cancel their appointments and there's availability. Locally, you have to go to each distinct entity to make an appointment. So if it's a pharmacy, you have to go to their website. If it's a federally qualified health center, you have to be in communication with them. And for the most part, they're reaching out to their patients. The county health department in Monroe County currently is doing essential workers, and they reach out to those essential workers through a number of different communication avenues, mostly within whatever the essential worker group is. So for example, they've been reaching out to teachers through the school districts. They have in the past reached out to all of the emergency medical workers through the EMS system. And so their pods or points of distribution clinics are essentially closed because they're doing them by reaching out to particular groups of people. That is probably going to change in the next week or so because increasingly they will also be vaccinating people with chronic conditions. So take home message, you know, supply is the issue. And unfortunately, expanding the eligibility as the governor has been doing really doesn't help because it just makes more people frustrated. So now we have, you know, probably the majority of the population eligible to receive a vaccine and just nowhere near the supplies we need to be able to vaccinate them. We definitely have the capacity in our region to vaccinate everyone who wants to get vaccinated, but we just don't have the supplies. One of the real drawbacks also is that there are multiple different approaches for best delivery of vaccine, and there are multiple different opinions about what the best approaches are. And so we're a little bit at the we're at the mercy of the state and whatever decisions they make about how they think vaccine is best delivered. But we also have a lot of ideas about what we think works in our region and for our people. So we're trying to balance those two things as we go forward. And just an example of that was that this week, the Monroe County Department of Public Health got a large allocation for people between the ages of 16, actually anyone over 16 who had a chronic condition. And their plan is to redistribute quite a bit of that vaccine to federally qualified health centers. We know that people who are most impacted by this pandemic are getting vaccinated at slower rates. And we really want to ensure that they do get vaccinated, and federally qualified health centers and safety net clinics take care of many of these people. And so the health department has the authority to redistribute that vaccine and try to focus in on that population. But other than that, we're pretty much doing what the state tells us to do. And then just lastly, the week to week lack of a planning horizon is really, really frustrating to many of the vaccinators. They get vaccine, they don't know they're going to get vaccine until Saturday or Sunday, and then boom, they have vaccine, and they, have to plan really quickly, and they have to use the vaccine up as fast as they can. So that's the ugly truth. I thank you all, and I'm happy to take any questions you might have.
Thank you very much, Dr. Bennett. Great overview, very chock full of really, really pertinent information, great bottom line information. There is at least one question in the chat box, and I will get to you. The question in the chat box is a very good one, but also wanted to ask you, so what happens when you're expecting a big shipment of vaccine and appointments have been set up? I mean, I can see why this is frustrating, and you don't get what you expected. What happens to the appointments that were in place? Does everybody shift over one? I mean, how does that get addressed? That's gonna be tough.
Great question. So the state has repeatedly asked vaccinators not to make appointments until they have vaccine in hand.
Yeah.
And so that's what people have been doing. And, that just makes it really hard. It means that, on Sunday night, you say, ooh, I'm going to have vaccine, so you can start making appointments. But this week is a classic example because so at the Dome, they have appointments throughout this week, and they were expecting to get a very large shipment, and they haven't gotten anything either. They're going to be out by tonight or tomorrow. So they're trying to figure out what to do. There is this added wrinkle, which I didn't talk about, which is second doses. So the 2 vaccines that we're currently using require 2 doses. And the second doses follow the first doses automatically. So, if you got a first dose at a particular place, you just have to go back to that place in 3 weeks or 4 weeks, depending which vaccine it is, and you get your second dose. So one of the things that we're trying to encourage the state to think about is more flexibility about first and second doses. Currently, they're very specifically designated first or second. So just as an example, the Dome does have supply of second doses right now that they could conceivably use for those appointments for first doses, but then they'd have to be ensured that they would get those second doses too. So it's that first dose, second dose inflexibility has been very difficult. So long story short, there are a couple of places also that have second dose clinics that they're planned for this week, and they'll probably have to postpone them unless the vaccine comes. And there have been places that have made first dose appointments that will have to cancel them potentially. There was an article actually in the Times this morning about Mount Sinai in New York having to cancel lots and lots of appointments. And that wasn't because of the weather. That was because they were assuming they were going to continue to get vaccine from New York State, and they didn't. So,
Right. Well,
so it is, I mean, honestly, it's much easier to sit in my seat and try to be, the traffic controller than to be in the seat of the people who are trying to do vaccines on the ground, because it's just very, very frustrating. And then also, if you don't use your vaccine up in a week, everybody gets mad at you and they won't give you any more. So it's like you're really caught between a rock and a hard place.
Yeah. It's you're making very clear how challenging this is at all levels. It's not easy to be in your seat either. There's a great question in the chat box that I want to get to. How is it determined which vaccine, Moderna, Pfizer, et cetera, goes to which provider, pharmacy, state, county?
Mostly it's strictly logistics. So the Pfizer has to be kept very, very cold, and most people don't have those freezers. And so really the Pfizer vaccine has gone to the large hospitals and also to the Dome Arena because they have those freezers. But Moderna is going to most other places. The other thing about the Pfizer vaccine is it comes in very large quantities. 975 um, and doses. And so, you know, for places that are trying to do smaller clinics, they really, you know, wouldn't want the Pfizer. So that's really been the way that it's been decided recently. So most providers in our community now are receiving Moderna, not Pfizer. You know, with the addition of the Johnson & Johnson vaccine, that will make things also more complicated, but also better in some ways. It's a single dose vaccine, and it also has much less stringent requirements for freezing and temperature control and so forth. So we're looking forward to that vaccine being added.
Yeah. Yeah, I was hoping you would mention the J&J vaccine. So that's great. I'm sure a lot of people are you know, anxiously awaiting the J&J vaccine to be approved. So there is, you know, I just realized that I didn't know until today. So there is no difference between the first vaccine and the second vaccine where 1-2 punch is needed. It's not as though there's a different kind of dosage or strength, or they're actually the same thing being given twice.
Exactly. They're exactly the same thing.
Okay, very interesting. And what should people be prepared to bring to their vaccine appointment? What is required? You need a passport, you need a driver's license?
It's a very good question. So a little bit depends on what your eligibility is. So if you're an essential worker, in addition to just, you know, identification, so you need identification just to establish who you are. But if you're an essential worker, you also need some kind of proof that you are an essential worker. Now, this is, I think, a little less stringent at the convention center because they know who they're calling in and they know who they are. But in general, you need to be able to prove you're an essential worker. If you're over 65, obviously that's on your identification. If you're a person between the ages of 16 and 64 with a chronic condition, the governor determined that there were 3 ways of proving you had a chronic condition. One was to bring a doctor's note, one was to have some medical records, and the third was to attest to your medical condition and sign a signed attestation. So that's what we're going with in our community. There's been some confusion at the Dome. There have been people turned away from the Dome who didn't have a doctor's note. That was a mistake. It shouldn't have happened. And I'm sure they're remedying that. So it's really in our region, just an attestation. Now, if you decide to go somewhere else outside our region, I can't tell you for sure what will be required. So you should definitely check ahead of time. So some of the counties are, and some of the regions are different, but even worse, some of the individual counties are different. So you really do have to check if you're going somewhere else.
You must have read my mind, because part of what I was kind of leading to is that I know of some people who have gone to other counties and gotten the vaccine without any questions asked. And so, you know, I wondered if that was sort of an anomaly, or if that's sort of because there's a big patchwork of regions and counties involved and the rules are all slightly different. Plus there's evolution over time. Is it sort of all the above?
Yeah, the basic rules are the same across New York State, but the attestation, you know, some places are requiring a doctor's note. We thought that was really a burden on the doctors, frankly, and also a real equity issue, because not everyone has a doctor, and not everyone has ready access to a computer to email their doctor and ask for a note. And we just thought that was really a barrier that we wanted to remove. And so that's why we don't have a requirement for a doctor's note, but some places do. And that was left up to the counties. Some of the basic tiering and the eligibility is statewide, but some of the specifics have been left up to the counties.
Got it. We have another question in the chat box. Do you think the recommendations for J&J will be targeted to a younger population due to the lower efficacy, to leave Moderna and or Pfizer supplies for older populations?
Yeah, I don't know if that will happen. I do want to say that the J&J vaccine is really not less effective. Its overall efficacy was less than the Pfizer and the Moderna, but there are a couple of reasons why that could have been the case. It was tested in South Africa among other places. And that's really where the numbers got brought down. And we think that's because there were more people with the South African variant and that it may not be as effective for that variant. But the overall efficacy at preventing severe disease was 85%, which is terrific. And so we really think that, we shouldn't think of it as less effective, that it actually was really good. And its efficacy in preventing death was 100%. So I think it's a pretty good vaccine. The vaccine we get every year for flu never has anywhere near that efficacy.
Oh, really? That's great to know. I mean, that this is, comparatively that much better.
Yeah. I mean, flu is often 50% effective.
Oh,
okay. And it still prevents an incredible number of deaths and an incredible number of hospitalizations. So I think, we shouldn't feel like the J&J is a second-rate vaccine. It's still really good.
And being one dose is terrific.
Yes.
Which, I just want to jump in and say the other question in my mind is, so what happens if somebody has gotten the first dose and they don't show up for their appointment for the second dose, which probably you're encountering or you're going to be encountering, right? So do they have to start all over again? Are they out of luck? How does that work?
Yeah, no, it's definitely starting to happen. It's the rates of showing up for the second dose are very high, very high. People are being terrific. But nonetheless, things happen. We had one person who had a car accident, was injured. We had another person who was in the hospital. Things do happen. So the recommendation is to try to get it as soon as you can. But the CDC has now said you can wait up to 6 weeks. And even if it goes longer than that, it's still considered effective. So, if you miss your second dose appointment, and we beg you not to, but if you have to, then what you really need to do is figure out where you can get your second dose. That's the rub. It just is complicated to find a second dose for you. So we advise people not to miss their appointment, but if they do, they don't have to start over.
Well, that's very good news. I think you said this, but I just want to ask again. I was just watching on the news, this morning, some coverage of vaccine administration, and I think it was Los Angeles or thereabouts, which kind of prompted me to want to ask this because there were some, for the majority of the administration was happening in specific sites, big sites like the Del Marina, and and you needed an appointment in order to be able to access the vaccine. But then in order to sort of counterbalance access issues, equity issues, they're starting to bring the vaccine into communities. And it sounds like you don't need an appointment at all, kind of a very different approach. And so I wondered, again, just to ask this for my own, confirmation, people do need an appointment at this point in the Finger Lakes region, regardless of all those sites, all the different populations. It's still appointment driven, correct?
Yeah, and we even have been doing what we call pop-up sites, which isn't a very good name for it, but New York State has given us extra vaccine almost every week to do pop-up sites. And these are targeted to populations most impacted by COVID, so people of color for the most part. And we've done, 3 or 4 in Monroe County, and then also 1 in Geneva. And at these events, rather than having to make an appointment online, we have targeted particular populations, and people have signed up, face-to-face or by phone. And we've tried to make it really easy, but still appointment-based. One of the things we're not eager to see is long lines of people waiting.
And then possibly being turned away on top of it.
Yeah,
so vulnerable populations that could be, be fraught with some issues.
We've you know, worked out this system too, where, you know, you never know exactly how many doses you're going to get out of a vial. That's another complexity of all this. Both Moderna and Pfizer have ended up having fuller vials than anticipated, and so you get extra doses. So the other thing is, in addition to having appointments, we often have a waiting list of people who are willing to be called on the spur of the moment to come in and get vaccinated, because we don't want to waste any doses.
Right, right.
So
There's another comment in the chat box that I want to get out here. One of our participants is saying, I was lucky enough to get into the system on Sunday and get an appointment for Friday afternoon. Do you expect the supply delayed due to weather to catch up soon? To clarify, the New York State site and the appointment is at the Dome.
right. Yeah, stay tuned. I'm hoping they'll either get vaccine or be able to transfer some second doses into first doses, one or the other, and not have to cancel. But I would definitely, you know, stay alert, because it may turn out that they're going to have to move appointments.
Okay.
But we'll certainly hope not. I hope that by the end of the week, this will get sorted out.
Yeah. There are a couple of other questions that I have, and I hope people either unmute yourselves and speak or put your questions up in the chat box. One is, if you're making an appointment in order to come in and get the vaccine, right now there are two major choices, right? The Pfizer and the Moderna, eventually there'll be 3. Do I have the ability and the right to ask for the vaccine I would like?
Unfortunately, no. There was one brief exception to this. At one point, some of the hospitals had both kinds, and their staff were able to choose, but that was very minimal. I mean, it was small numbers of people. By and large, no, because, you know, again, the Pfizer is only being given at places that have these large freezers and that can take care of the Pfizer vaccine. So currently, really, it's only the Dome. Originally, the hospitals did have Pfizer, but recently they've just been getting Moderna, I think. So
at this point, you can make some fairly safe assumptions regarding what you're getting, you know, based on where you're getting it.
yeah.
But
And I don't think there's really, I mean, as a medical professional and as a doctor, I really didn't care which I got. I mean, I think that, you know, they're both very effective. The side effects seem to be very similar. You know, they're mild. I shouldn't say they're mild. Some people have a really lousy 24 hours. So.
Well, you're kind of heading right into another sort of question that I think is out there, because it's, you know, been discussed and it's out there on social media, on the internet, and that is, you know, there's certainly some people that have had reactions that are really allergic reactions.
Yeah.
And so those are frightening. Can you just speak a little bit about that as a, you know, a percentage, and also as what can be done to sort of mitigate those sorts of you know, those sorts of circumstances from even, you know, happening.
Yeah.
Yep.
Yeah. Thanks for that question. I don't know the exact numbers right now. Now that we've given so many millions of doses, there is undoubtedly an exact number out there that I don't know. But the thing we worry about most is having an anaphylactic reaction to the vaccine.
Yep.
And those have mostly been seen in people who've previously had anaphylactic reactions. So if you have had an anaphylactic reaction to a vaccine in the past, you should definitely discuss with your physician whether or not you would get this vaccine. Part of it depends on what they think you might be allergic to specifically. And you also should receive the vaccine in a controlled setting where you can be cared for. Saying that, all of the places that vaccines are being given right now are pretty controlled settings, but you might choose to avoid a church-based clinic, for example, and go to, you know, one of the bigger sites. Mm-hmm. And then people who are having, if someone has an allergic reaction to their first dose, they will, I mean, if it's an anaphylactic reaction, they will be recommended to not get a second dose. But if they have some other kind of reaction, again, wise to discuss it with your physician. In all likelihood, if it's minor, you can still get a second dose, but important to discuss with a health professional. You know, again, the anaphylactic reactions have been very rare. They're not happening a lot. Knock on wood, I don't believe we've had full blown. I think we may have had one or two people who were, you know, a little bit uncomfortable afterwards, but I don't think we've had a full blown reaction. So they're quite rare.
Yeah. And just to sort of say, an anaphylactic reaction is one where you have trouble breathing, your throat swells, right? They're the kind of reaction that you would have if you're, you know, deathly allergic to penicillin or to bee venom or to any number of things that people have those really horrible, life-threatening reactions to.
Yeah.
So if you've got that kind of a background, that kind of a history, you should be talking to your doctor. Make a plan with your doctor.
Yes,
and there
definitely.
are ways to either you plan not to have it, or you have it in the best of controlled situations. Maybe I'm not dispensing medical advice, but perhaps there's an EpiPen nearby, or, you know.
Oh, there is in every clinic. You know, as one of my colleagues once said, the way you manage a vaccine clinic is you have an EpiPen and you have a cell phone. You know, it's like basically.
Right. Okay, great. We have another question in the chat box. Do you think we will have a similar tier system in the future if there are boosters needed for different variants? Great question.
Ugh. I hope not.
Yeah.
Really hard to know. I would hope that if there are boosters needed, that this could be more incorporated into the general healthcare system. So what I mean by that is that we do actually vaccinate a lot of people for flu every year, and we do it just through the general healthcare system. We sometimes have some special clinics, but by and large, people get vaccinated through their doctor's offices or their clinics. I would hope that if we have another go round of this, that we'll be able to do it that way and have a less complicated system to approach it. I suspect for some special populations, we're always going to need to have some mass clinics, but it doesn't have to be on the scale that it is for this.
Mm-hmm. Terrific. I've got two more quick questions. I hope they're quick because I know you're being very generous with your time, but we.
Oh, I'm fine.
Okay, good. So, and certainly please feel free to put, there's a nice comment, by the way, saying how helpful this has been. So thank you, Dr. Bennett.
Oh, thank you.
Yeah. One question that I think people could have out there, it certainly crossed my mind, is who are the people that are administering vaccines? How well trained are they? Are they medical professionals? If not, what sort of training do they go through?
Yeah, so the governor did expand the groups of people who could give vaccines. Prior to that, it was really nurses mostly. So he expanded it somewhat to, EMTs, for example, students in nursing school, pharmacy school. Pharmacists have always been able to give vaccines. I think there are a few more groups that have been added, but by and large, they're all people who have some medical training. And in fact, the students have to have had some clinical time. And then in addition, on top of that, they need to take an online course about this vaccine specifically. Currently, most of the vaccinators that I'm aware of are nurses at the hospitals and in the large clinics. Increasingly, as we expand our operations, we probably will call on some of these other people. There also is a huge volunteer cadre of retired or various people who have clinical skills who are willing to help staff some of these clinics as we start to have more and more vaccine.
Yeah, which is great news, and certainly some of the very positive news this morning is that we have a system in place and we have a lot of capacity, operational capacity with the system. It's not that the system's not in place. It's not that the people aren't in place. Yeah. It's that the vaccine we need greater quantities of vaccine to come more often.
Yeah, and one of the things I didn't
with more lead notice.
Yeah,
yeah.
And one of the things I didn't mention is that the United Way has an amazing volunteer system, and they have partnered with us. They've gotten, I think, 2,000 volunteers, large numbers. Maybe 2,000 isn't quite right, but lots. And of those, quite a number of them are clinical providers. So that's really good news.
That's very good news. And that leads me to my last question. It's sort of a multi-tiered question, could be anyway, and that is, what can we do to help you? And you could answer this in a couple of ways. One is if somebody wants to volunteer, maybe a medical professional, maybe not, because I imagine there are volunteer roles here that are non-medical, even just guiding traffic, right?
Oh, yeah.
Right, is a role I can envision. And then is there anything that we can do to help you get the word out in general to the community? Is there anything that we can do to help even encourage the state, for example, to reconsider using hospitals? You mentioned, that hospitals had played a role in administering the vaccine, and that it could be useful to reconsider that. It's certainly a controlled environment, right?
Yeah, yeah.
Patients in hospitals are going to be high-risk people, so it seems sort of like to me, I'm not, kind of an uneducated lay person. Seems sort of like a no-brainer to put the two together. But what, in any and all of those ways, are there things that we can be doing that are helpful? And then obviously there are things where we should keep our noses out, perhaps.
I don't know any of those. I mean, I think certainly volunteering is great, and the United Way does have a wonderful system. People are a little frustrated right now because we're not using many volunteers because we don't have enough vaccine, but there will be a time. If you volunteer and no one calls you, don't feel bad. It just may take some time. That's certainly important. Another thing is getting the word out. And I think the most important message to the community is be patient. I think people are feeling as though this is life and death, that they must get vaccinated next week or something terrible is going to happen in their lives. And we're all eager to get vaccinated. That's completely understandable. But I don't really think it's worth the tremendous lengths that some people are going to. I mean, spending hours on the computer, driving to Potsdam to get a vaccine. I mean, it's, I think that we all need to take a deep breath, and we need to recognize also that our behavior can't change that dramatically just because we get a vaccine, because lots of other people aren't vaccinated and our community rates of disease are still quite high. So, it doesn't really matter if you get vaccinated next week or next month, to be honest. And so I just, if people can be patient, they will get vaccinated. It just may take longer. And so I think that's one of the things that we really want people to understand. And we also want people to understand that there just isn't enough vaccine. And that's very frustrating to everyone involved, and that they're not alone in feeling frustrated. It's frustrating to all the vaccinators even more. They're like raring to go and don't have it. So I think those are the main things, is really getting the word out, and also sending people to the resources that we do have so that they can get more information. The last thing we didn't talk about at all is vaccine hesitancy. And that's another important message. There are people who still are very distrustful of this vaccine. And I think sharing as much information as possible with those people, answering their concerns, really helping them to achieve a level of comfort with getting the vaccine is very important.
Thank you so much. I think this has been, you've covered a lot of ground. I think we have a great understanding of, I certainly have a much greater understanding of the issues that are being dealt with, as well as anybody can. You do what you can with what you have where you are. It's one of my favorite paraphrased quotes from, I believe it's Teddy Roosevelt, actually, that keeps me sane.
Yes.
Pretty much every day.
We all need that.
We all need that, yes. And we so appreciate your coming and talking with us. Dr. Nancy Bennett, lead for the Finger Lakes COVID-19 Vaccine Hub. We're glad that you're there, ensuring that that these issues are being addressed, that the system is being obviously has already been worked out, and we're anxious to help in any ways we can. So we hope people go to the United Way. We hope people share information with their friends, and we're going to put this up as a resource for folks, not just in the membership, but in the community. It's great that you've been here to talk to us and give us the specifics. We hope that you come back at some point in the near future. And we wish you and your team all the success in the world in leading something that is so important to our community. Thank you so much, Dr. Bennett, for joining us this morning, and thank you all as well.
Well, thank you so much.